clients, patients, friends, and neighbors. My name is Dr. Amanda Ennis. I'm here today to demonstrate some techniques for restraint for our dog patients that we use here at Metropolitan Veterinary Center. With me to help me out is one of my favorite patients. His name is Tito, and he's a little Chihuahua. He's a very good boy, so normally we probably would restrain him with just, the minimum, but I wanted to use him because he'll be easy to show you some other techniques that we use. First off, I will say that I am a big believer in the path of least resistance being often the easiest and most effective. So treats can be a really good motivator, especially for our dog patients. Let's see. Oh, Tito loves the treat. So by giving a treat and having the dog focus on that, it's certainly very possible to have them hold still. And in a number of cases, we can look at the ears this way. We can give vaccines. In many dogs, we can even take the temperature this way. So I would say don't overlook food as a way to motivate your dog. I would say that's our #1 go-to restraint technique here. Secondly, there's what we call a standing restraint technique. You might see this used commonly by our technicians, especially if you have a dog who is trying to jump off the table or won't stay still on the floor when we as the veterinarians try to examine the patient. So what this looks like is basically me bringing my hand underneath Tito's neck and then bringing my other hand up underneath Tito's belly. In this way, he's very close to my body, but he really can't bite me because I have a hold of his neck, and he can't flail around a whole lot, and he's pretty immobilized if we had to give him vaccines or shots in his shoulders or take his temperature. We can do this the other way too. If we needed to give injections on the other side, then we could turn him and do the same thing on the other side like this. And little Tito's head is here, but it's very well controlled by my left hand, and then my right hand is underneath his belly. So he did great with both of those techniques. I'd say another technique that we sometimes use for dogs that are trying to bite us is the technique that involves a muzzle. It's a soft, flexible muzzle, and it's tailored to the size of the patient. So I'll turn Tito to the camera and then demonstrate how we use it. So the shorter part of it goes on the dorsal aspect of the snout. So the bigger part with the tag goes underneath the jaw. So you slip it on like this, and then it has an adjustable strap in the back, so you can adjust it to the size of the patient's neck. It clicks into place, and then you can tighten it just so that you get a good feel that the patient can't just slip it off or paw it off his head. But little Tito seems to really be fine with his muzzle. I'm not sure if he could eat with the muzzle on, but some dogs can. See if I can give him a little piece. Oh, yeah. Oh, there we go. So he can eat with it. Obviously, if he was really an aggressive dog, I wouldn't be putting my hands near the end of the muzzle. But at any rate, I would say this kind of transitions into another restraint technique that we sometimes use for dogs, which is called a lateral restraint. This is helpful not only if a dog is biting, but if it's hard to get them immobilized when they're standing. It works for big dogs too, although you might need an extra hand or two to get them in the proper position. So, using this technique, you kind of use your body to grab the patient's legs. Oh yes, there we go. There we go. So you grab the underside of the leg. Oh, Tito. Tito. So that's kind of the general idea. I feel bad for Tito because he's trying to be a really good boy. But at any rate, so you hold him underneath, put him on his side. There we go. And then put your wrist on his neck, and you can hold one or both of his back feet down. And this would be a helpful way if someone needs to visualize the nails to trim them up, or if you don't want a patient to kick you when you're taking a temperature, or if you wanted to administer vaccines or give injections, this would be a reasonable approach. So I'm going to let Tito up. He was a very good patient. And then I'll demonstrate a last technique, which I think works pretty well in cats and small dogs. You may have seen this if you watched my cat handling video, but it involves using a towel, similar to just like a big bath towel, to help restrain smaller patients. So you can take the towel and basically just put it over the body of the patient. It would be easy to pick up a dog who is trying to bite you in this way. You could also uncover his head and then perform a little bit of a swaddle. So rotate the blanket around his neck and kind of burrito him in there, so that if you needed to get around his head but you were worried about what his feet might do, this would be a good way for a veterinarian to examine the ears, use their hand or a tongue depressor to lift up the gums, get a look at the teeth, but not have to worry about what was going on with the paws. In this way, you can always remove one paw, so you can cover one paw and remove the other paw to do things like a nail trim, or take a look at the paws. So Tito was awesome for that. This was just a kind of quick demonstration of a few techniques that you might see us use here at Metropolitan Veterinary Center. And as always, I appreciate you guys tuning in, and I hope that this was helpful.